Some of the most difficult and important work in healthcare happens behind the scenes. It's never in the headlines, but it's critical to the diagnosis and treatment of cancer, which is especially important in Kentucky.
You really can't do much to treat a patient until you know their diagnosis. You can find out a lot of information by testing blood, but to really see what's going on inside the organ itself, the bone marrow, you have to take a biopsy of the marrow. It's unfortunately a painful procedure, but there are times when you really just can't get the answer until you see what's inside the marrow.
Bone marrow is the body's factory for blood cells, and bone marrow samples provide key information that can't be acquired in any other way. But since anesthetics can't reach inside the bones, sampling can be painful. It takes a special kind of person to do it right.
You have to be patient with the patient and understand, you know, they're scared. They have just been diagnosed with a blood disorder. So you have to sort of be able to put yourself in their footsteps and understand how scared they are. But once you leave the bedside, you have to be able to leave that behind and come to the lab and be able to precisely process all of the specimens.
We're a bit behind the scenes. You know, we do go out to the patients, but you know, a lot of the other hospital areas do not know about really what we do and how important we are.
It's a behind-the-scenes discipline, but it's vitally important to ensure that patients get the diagnosis they need. Part of the reason UK is such a referral center is because we have a very specialized team that it takes to be able to do these biopsies on a routine basis. We have the laboratories needed in order to process the specimen. The technicians who work in the laboratories are spectacular.
The lab is definitely part of their care. A lot of times you'll hear things like, well, the doctor told me, and I'm going, yeah, and we told the doctor type of thing. The lab is a very important part of the healthcare team.
Unfortunately, Kentucky is a state that has a high incidence of cancer in general, and that also includes leukemias and lymphomas and bone marrow disorders. So it's very important to have a well-run team and a very integrated team like we do here at UK.
UK's bone marrow team is one of the great untold stories in healthcare. Dedicated frontline professionals whose empathy and experience are essential in the treatment of some of Kentucky's deadliest and most prevalent diseases.